I'm excited to welcome Emily Santinelli, the Vice President and Consultant at USI Insurance Services, to join us today to talk about some alternative benefits you can provide employees when budgets are cut. Emily has more than a decade of experience in the wellness industry and employee benefits sphere. Prior to benefits consulting, she spent several years in wellness, including starting her own consulting company. Thanks for being here, Emily.
Thanks so much for having me. So just getting started today with our session. This is going to be a quick session, so I kind of wanted to lay out how we're going to use our time today. We just have 20 minutes together. Employee benefits, the way I view it, is a really, really large umbrella. And a lot of times people, when they think of employee benefits, especially those in a finance role, will only think of that health insurance piece because it's the biggest chunk. But really, employee benefits should be a really, really large umbrella. And given that most companies probably on this call have already made decisions for their health insurance for 2021, we thought maybe a better way to spend the time would be to go through some statistics that are very relevant right now to HR professionals and recruiting, and then also go through some quick ideas of if you've had your benefits budget drastically cut this year due to COVID, what are some really practical things you can do to enhance your benefits even after decisions have already been made for this coming year? So really quick, I want to go through some stats, kind of the lay of the land, where things are, and then we're going to get into those ideas and solutions that hopefully you can just kind of grab and go and take and start to implement within your organization right away. So some things to know: mental illness was already an epidemic prior to COVID-19. So 1 in 5 Americans, 20% of Americans were already reporting symptoms for mental illness. That has only increased with COVID. So now we have 1/3 of Americans. Calls to the federal disaster hotline, so these are things like the suicide prevention lines, they increased by more than 1,000% in May of 2020. Not going through all the bullets, but 1/3 of employees still worry about retaliation or firing when they seek help with mental health care. Even though we're working as employers to get rid of stigma against mental health issues in the workplace, it's still a real fear that employees have that if they seek help, or if they talk to HR, or if they talk to their manager, or if they feel like maybe they need to go on leave due to a mental illness issue, that somehow there won't be understanding, that somebody will try to get rid of their job. This should be kind of an obvious thing, but other comorbid conditions also increase your risk factor for mental illness. So thinking along the lines of diabetes, autoimmune disorders, heart disease, when we have physical pain or physical struggles we're dealing with, that also affects our mental health as well. Next slide. I think we gotta go one more. One back, please. Thank you. Oh, it keeps popping. So one back. The next stat is on loneliness. So Cigna did a study in 2018. They've also come out with a new study in 2020. But prior to COVID, Cigna found that loneliness is as deadly as smoking 25 cigarettes a day. 2 in 5 Americans lack meaningful relationships. And Generation Z, so our incoming folks into the workplace, are considered the loneliest generation. This is really telling and important, especially for right now, because in 2020, given the pandemic, not only was this an issue before COVID, but definitely now we're all feeling even more so a sense of isolation. We haven't been able to see people in person. And I think we can all agree that social media can sometimes be a toxic place, and it's not necessarily meeting our needs for that intimate connection with other human beings. One thing that is newer with COVID, and I think that this is really important, especially as HR professionals or leaders within organizations to know about and start to think on, is women in particular leaving the workforce. So during August and September, 1.1 million people over the age of 20 left the workforce. Of that number, 800,000 were women, compared with just 216,000 men in the same time period. We know that historically women have had a lower earning than men, and women are leaving the workforce or looking to find another job, according to McKinsey and Company, 1 in 4 are contemplating leaving their current job to find something that is either less demanding or has better work-life balance. One really big challenge, especially for parents, but especially women right now with COVID, is childcare. Not all schools are open in person. Even those that are, there's still people that have young children at home that are not school-aged. Some daycare centers have reopened. However, they have had to limit capacity. So parents are struggling, families are struggling with not having anywhere for children to go. Not everyone has family that lives nearby that can help out and pitch in. So family units are having to make decisions about which parent would be able to quit their job and stay at home to take care of children or help with homeschooling or different things that are our reality right now. And because women have traditionally had the wage gap, we're seeing more and more women make that choice to leave and stay at home just purely out of necessity. One thing I even heard today on my way in, the BBC reported, I know we're focused on America in this presentation, but in Japan, suicide rates among women have gone up 80% in Japan, and this is due to job losses because of COVID. So definitely a demographic that's being affected. Next slide, please. So for the first time and maybe ever for your organization, the wine industry has typically had really, really rich benefits, really rich health insurances, ancillary lines of coverage, tons of vendors involved with, all kinds of things from childcare services, elder care, EAPs, whatnot. And this year, a lot of organizations are having to make really large and deep cuts. Not everyone, some people remain immune to it because they're still producing a high volume of product. And I know my own wine consumption has gone up during COVID, but that's not necessarily true for every organization that's on this call. Some wineries, some those in the wine industry have had to make really deep cuts, and it's come through layoffs. It's come through massive cost shifting to employees where for the first time, maybe they're having to raise deductibles or drastically cut contributions to things like health insurance. So what we want to do is go through some quick ideas that are non-traditional benefits of what you can do outside of health insurance, dental, vision, whatnot, to help keep and retain those employees under that employee benefits umbrella. So one thing that you can start doing, and it's never too early to start, is benchmarking your benefits. Typically when I benchmark my clients' benefits, we're looking at it in terms of 3 cuts. We're looking at it in terms of industry, in terms of geography where you're located, and then employer size. And we look deeply into those 3 cuts. Now, a lot of wine, those in the wine industry are having to make cuts. So I would recommend just looking at 2 cuts, those cuts being geography and employer size. You're probably not going to lose a lot of employees by making slight cuts to your benefits if you had to do that this year. But what you want to evaluate is, could your employees leave and go to a different industry altogether and find better benefits? And that's maybe where that cutoff point is of, we can make some cuts, but we don't want to cross this line. Another thing I would focus on for 2021 is holistic wellness. My own background is in wellness. And one thing that employer groups hear a lot and vendors tend to tout is that wellness is going to save you so much money on your health insurance costs. That is not necessarily true. University of Illinois came out with a study in May of 2020 showing that wellness programs do not really save the employer or the employee on healthcare costs. So given the statistics we showed on the first 2 slides, instead I would pivot your wellness efforts to focus more on belonging and community. Employees, we want them to be sticky. I call them sticky employees. We want them to stick to the organization, and as many touch points as we can have with our employees and engagement is really good. So don't think about cost savings with wellness right now. Think about creating wellness that creates a sense of belonging and community where people feel like they're connected. Invest in mental health services. If you have any dollars at all, I think a good place to spend them is in mental health services. If you're looking for justification for that, sometimes that has to be approved by executives or a leadership team. The World Health Organization has a study that for every dollar employers spend on mental health care services, they reap back $4 in return in terms of productivity. So if you have money to spend, this can be a great way. There's big vendors like ComPsych, EAPs. Those can be very costly. EAPs historically very low utilization, less than 10% utilization. So a couple other ideas you might want to think about is, can you partner locally with a behavioral health specialist or mental health practice therapist that could maybe do something for your organization? This would be especially relevant for smaller to mid-size employers, maybe not really, really large employers with a distributed staff. But could this be done locally where you could, for a set fee, work with a local practice to help give your employees practices that they can do to help, their home life, work life. Another great free resource, if you're not aware of it, I've used this with a ton of clients, is the Greater Good Science Center out of Berkeley, or Greater Good in Action. There is a lot of free videos, blogs, articles that you can share with employees. And then as a team, there's free courses that you can audit on there as HR professionals, or you could put together a committee within your organization to take these classes on happiness in the workplace, resiliency in the workplace, and come up and generate some ideas specific to your organization for ways you can find some free things to do that might be meaningful, specific to you. Points 4 and 5 go together. And I know I'm going kind of quickly, so if you have questions, just put those in the chat. Erin's going to get those to me, and I'm happy to give you more comprehensive thought or answers after our session. Consider flexible schedules. Our last speakers talked about this as well. Consider flexible schedules whenever possible. Given that women in particular and parents in particular are struggling right now with childcare, with schooling, with maybe taking care of aging parents or those in their family with health conditions. Think about flexible schedulings and possibly job sharing. This goes with point 5, which is consider cross-training your employees. If you have an employee that has to be in person due to their job duties, they can't remote work, ask them if they'd be interested or willing to cross-train with a position that has more remote work available. If you have more than one employee on staff in that position, if you get a few people cross-trained, perhaps you can blend their jobs or job share where half-time those individuals are able to be remote and be with their families or take care of things at home that need to be taken care of. And then the other half, they're in person and you're still making sure that those shifts or those job duties get covered. The other thing this does is it helps our employees have a sense of control over their own destinies. We as human beings love to have some say-so. We like to have control over our destiny. And as our first keynote speaker talked about, right, we feel better. It's a human condition that we want to have a say. When we include employees in the decision-making process of what their job might look like in the future and give them more opportunities, they're going to feel better about employment and they're going to stick around for the long haul. One idea we're seeing in tech in particular, so video game companies, software development companies, app-based companies, are forced well-being days. So some employers are choosing to do one Friday a month off, closing the doors, and they're making it hard for their employees to access email, phone, so they truly have to turn off and then spend the day, the idea is, in self-care. Now, in the wine industry, a Friday may not be ideal to take off. That can be a heavy traffic day, a heavy production day, right? But the idea is there any time you could close the door in addition to your employees' PTO where you can say, hey, we're going to do some forced time off. We recognize that this year's been really hard. We want to give you some time to take care of you, to take care of your family, and evaluate where that could be done. Next slide, please. Encourage your employees to see a primary care physician in 2021. We've had a whole year of not seeing primary care physicians because things have been virtual or practices have been closed. So as soon as things start opening back up, doctor's offices, we want to get our employees back in to have FaceTime with their PCP. There are a couple reasons why. That is often the first point of contact. You're already paying for benefits, so why not promote the heck out of this? We want to have a place where employees can talk to a doctor, especially if they're having mental health struggles, where they can get a referral. And the PCP is often a place where a person for the first time may feel comfortable saying, hey, I'm really having a hard time. So the other reason we want to encourage PCP visits in 2021 is, no, it may not save you money on your health insurance costs unless if you're a larger or self-funded employer, but where it can make a difference for all size organizations is in your X modification score and your workers' comp claims. If you have an employee with a comorbid condition, so diabetes, depression, smoking, obesity, if you have somebody with a comorbid condition and they get injured on the job, okay, and no matter how many safety classes you have, somebody's going to have an accident at some point. An employee with a comorbid condition, especially one that's not managed, that workers' comp claim can be 3 to 8 times higher than an employee who does not have a comorbid condition and it gets injured on the job. So not only does this help the employee by going to the doctor, we want them to go to the doctor, we want them to get diagnosed early on with things, and we want them to be compliant with the treatment plan. That's going to help the employee, their quality of life, and it's going to help you, the employer, as well. Moving on to a few other ideas, classes. Think about what kind of classes that you could just pay a flat fee for, or maybe some people will even volunteer their time speaking to do for your employees. So financial well-being classes, how to budget, how to start saving for your kids' college, cooking classes, virtual yoga classes, maybe online painting parties or something, things like that, where they can, experience a social dynamic. You can use a vendor for some of these things for sure, but if you have $0 for vendors right now, see if a local bank wants to help you out with the financial well-being class. See if your 401k broker would be up for doing something for your employees. This is a time to call in some of those favors. Vacation donation policies or PTO donation policies. A lot of organizations are moving to where their employees, if I'm not going to use all my PTO, I can donate it to another employee who really needs it right now, who's going through a healthcare crisis, or who needs to stay at home with their kids, or who has a parent that's aging or that needs to have extra care. So that could be an idea. I loved the idea of travel gift cards or vouchers. So we have all had the experience where we've had to put travel on hold. Go figure, I was supposed to go to Italy in May, and obviously that did not happen. So we've all had to cancel trips, and it's an idea of having hopeful, looking forward to something. So maybe using the beginning or first half of 2021 to do some kind of travel gift cards or vouchers. I know at USI, in our own organization, our service employees can win awards. And with that, we have a service set up, a concierge service, where a concierge will call them and help them, plan an experience, jumping out of an airplane or whitewater rafting or a spa day as, being an award winner. And you may not, again, have a budget to enlist a vendor like a concierge service, but could you even start buying gift cards for Southwest Airlines or another carrier where people could get those and start planning vacations? 11, is there a way to help with any childcare expenses or partner with a childcare provider? Knowing that a lot of employees have lost their childcare through a daycare center, people are starting to have to hire in-home nannies, in-home tutors, things to help with their kids. Is there a way that you can help take care of some of those expenses in 2021 to offset that hardship for those employees? And knowing that retaining them long-term is more valuable than the cost that you're having to lay out to help meet them where they are. Another great option is a student loan repayment assistance program. There are vendors that exist where it does not cost you anything as an employer, but they can help employees reduce the amount of student loans that are owed. And that helps, decrease the burden for the employee. I know we don't have a ton of time left, so I wanted to leave you with a couple ideas. One thing I've been focused on a lot this year and reading, and I recently just read an article, the idea of keeping compensation and benefits separate in our minds. So sometimes they get lumped together. Compensation should always be a place where we have equity. There's a job description, there's a level of expertise, duties that need to be carried out, and we should have no disparity in pay for two people that have the same kind of job. Benefits is an area where you may see inequity. And what do I mean by that? You may have some employees that only take employee-only healthcare, premiums. You may have some that have family on their plan, and you're contributing differently to those. You may have some employees that have children at home and need different accommodations made right now, or that may need help with childcare reimbursement, whereas somebody who does not have kids is not going to get that benefit. Just like a smoker is going to go through a smoking cessation program. If you're not a smoker, you're not going to utilize that benefit. So starting to be a little more comfortable this year and into next year with saying, this is hard, we're all in this together. We want everybody to have a sense of belonging. And going back to even some of our diversity and inclusion talks in the last session, how can we meet employees where they are this year, knowing that not everybody's going to take advantage of every benefit that's offered. The last point I will just leave you with is communicate, 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 and accommodate, accommodate, accommodate this year. Communication was important prior to COVID. It's important now during COVID, and it's going to be important afterwards. You can offer a really wonderful and expensive benefits plan, but if you're not communicating how wonderful it is year round and helping your employees really understand it, they're going to be 60% less satisfied with your benefits plan, and therefore they're going to be less satisfied with you as the employer. You can have a benefits plan that's been cut, but if you're upbeat, you're adding new things, you're communicating, your organizational culture, your values to your employees, they're going to be more satisfied, even if it's not as rich of a benefit plan, and they're going to feel better about you as the employer. So I know that we're at 11:52. I wanted to just see if there's any quick wrap-up items or questions anyone may have.
Absolutely. Thanks, Emily. We have a follow-up question from Kathleen regarding the gift cards and travel vouchers. Are you then taxing those gift cards and travel vouchers through payroll or imputed income?
Yes, you would have, again, this is going to be for your tax attorney or whoever, your CPA, whoever you're using. Usually anything like that is going to have to be taxable income.
Okay, great. I have a couple questions, and I really love your focus on wellness today. And while I will not be skydiving anytime soon, I definitely love this idea about the forced time off to have your employees take some time for some self-care. You know, you mentioned shutting off email and phone, but really, how do you get your staff to take that time off? We're all doing more with fewer staff. We all have priorities. It's really hard to disengage and, you know, turn your brain off from those tasks. How would you recommend you get management on board and then actually do it?
Yeah, so that you answered the first part. You have to get management on board. This has to be coming from the top down. It has to come from the executive and leadership level, saying, we value you as an employee. We're not going to say you have time off and then expect you to get all these things done that you would normally get done in a shorter amount of time. So having that message, and then giving your employees maybe an out of office banner or something that they can put in their email that says, you know, when somebody sends an email, they're going to get the auto reply that says, hey, at such and such organization, we really value our employees taking time for themselves. And as a result, today we are doing a forced closure to make sure our employees take care of themselves and their families. So it's a positive message to those emailing, and then it also takes the pressure off your employees. And then, you know, for larger organizations, you know, with more distributed staff, it really is going to have to come down to not just the executive level, but even managers saying, hey, I understand where you're coming from right now, and I'm going to give you this truly to have time off for you.
Wonderful. That's it for questions. To those in attendance, if you have any more questions for Emily, please go ahead and throw them in the Q&A. We will email them over to her. Emily, thank you so much for talking about some alternative benefits today and really going through the statistics.
Thanks, guys. I know it was fast, so just let me know if you have more questions.